good morning, everybody. Thank you for coming in here today and allowing me to share my story. I thought I'd start by telling you a little bit about our academy and my organization. So my name is Anil Pai. I work for St. Luke's University Health Network. The organization is headquartered about an hour north of Philadelphia. And we have about 13 hospitals, 350 outpatient facilities, 2,000 providers, and about 20,000 employees. So me personally, I've been with the organization 12 years. Before that, I was in science. I was a high school science teacher. And so I've been in the learning and development field for about 25 years. I work at a corporate HR, and my responsibilities there under the organizational development umbrella is to oversee our learning technologies ecosystem, develop programs, and really source third-party platforms that work for our people. So the organization has grown a lot in the last 5 or 6 years. In fact, when I started with the organization, we were about less than half of the size that we are today. What St. Luke's is synonymous with, though, is quality. So this is where we take real pride. Our flagship hospital has been a top 100 hospital 8 years running. It's actually the #2 teaching hospital in the country, only to UPenn. And you'll see the numerous awards, but the one I'd point out there is the HIM Stage 7. What this award means is we have strong analytics, and we use that analytics to care for our patients. And so we take pride in how we use our technologies for the betterment of our communities. We have the university title in our name, and to underscore that, we have a partnership, medical school with Temple University. We also have a growing residency. This is something that's grown over the last 3 years. If you didn't know, in this country, the US, we have severe shortages with clinical professionals in healthcare. So physicians, nurses, assistant roles, allied health professionals. And so our goal is to build those pipelines internally. And our GME program, our graduate medical residency, that is one of the key strategies along with the medical school. On the nursing side, we also have a nursing school. It is actually the country's oldest operating nursing school, established in 1884. And this is kind of how the story begins. This program, the nursing school, has grown as well. A few years ago, we had cohorts of about 70. This was about 2-3 years ago. We started a nights and weekends program to provide the work-life balance that full-time employees needed to be able to attend. And that cohort now, they run on trimesters, is 100. We want to continue to grow that. This was a couple years back. I read 2.5 million shortage in clinical healthcare professionals. That's what this country is going to experience in the next year or two. And we want to be proactive about our strategies for growing our pipelines and our talent. So take a look at this mission and vision. I'm not forward-facing. My team isn't forward-facing. But what we do is we take this mission and vision and we apply it to the work that we do. So what do I mean by that? Our quality measures. Everything that we do, it's got to be high quality. We have to provide exceptional service and an exceptional experience for our employees. And we're a nonprofit, so we have to do that. Any dollar we spend, we have to do it cost effectively. To give you a state of healthcare in this country, most healthcare organizations are not making a profit. In the state of Pennsylvania, we're one of 2 organizations that is making a profit, and those margins are thin, 2%. So when I ask for money, my C-suite says, Anil, what is our return? Why are we making this investment? How is this going to help us? And that last one is really important to me, both from a personal standpoint, but also in alignment with our CEO. Everything must be easy to access. So I take that and I apply that into our technologies, into our programs, because we want to sustain and scale our organization as the best place to work. So that's a little bit about St. Luke's. Now a little bit about the problem that we're facing. Again, this is the story about our Be a Nurse Academy. It didn't start with me. It actually started in our C-suite. Our chief executive officer and our chief nursing officer, along with other executives, got together and they identified the problems. Severe nursing shortage. COVID did not help that. Every aspect of business was affected by COVID, but hospitals were severely impacted. The other thing is, within our organization, we have a reimbursement model for tuition assistance. That creates financial barriers. That's not equitable, that's not accessible. Finally, also localized to our organization, but maybe not, we have new hires that come through every week, 60 new hires on average, and we're not retaining them. That's a problem for us. If our culture is so great, if our work is so meaningful, why aren't we retaining them? I know the answer. We're competing with all types of industry, and we can't compete dollar for dollar with for-profits. The solution, our CEO said, was, hey, we have 20,000 employees. Why aren't we building our pipelines from our internal talent? And when we do that, we have to change this reimbursement model. We need some tuition-free pay-upfront programs so that our employees can complete these requirements without a financial burden. While the C-suite was talking about this was in the summer of 22. I was also doing some research and discovery. My goal is always, be prepared. Anticipate what your leadership is going to ask of you, so that you're ready for that ask when they come around. And what you'll see from a Josh Burson webinar that I attended is that when you compare healthcare to other industry, we're in hyperdrive when it comes to recruitment. We do a great job with finding talent and bringing them on board. Unfortunately, the retention and the reskilling, we're falling short. And so I took that, I put it in my back pocket, and I said, I want to solve for that. I want to help my organization solve for that. So when the organization makes a decision, St. Luke's moves very quickly. They pride themselves in being agile. They talked about this in June. August, they launched the first version. There's no name there, that's intentional. And so they created this tuition-free program with a local partner school. So there was many wins there, and I'm really proud of the organization for getting this done so quickly. We developed this partnership with a local community college. That was huge. What that partnership included was a pay-upfront business-to-business program. So this is now financially accessible for our employees. And during the 22-23 academic school year, 123 employees enrolled in the program. I love that. And you could see the requirements that our employees had to do at that college before they could enroll in our School of Nursing. So about 18 credits, science-based courses with labs, not the easiest courses. And when you look at the participation and who the employees are that were participating, they weren't necessarily ready, right? We were enabling them, but not in the right way. And so fast forward from August of 22 to about May of 23, my chief nursing officer came to me and said, hey, Anil, we need your help. We want you to take a look at this program and see if you can optimize it for us. So I took a look and I realized, well, the marketing stinks. Where's the name? Well, it's a partnership, right? Where's it advertised? On the partner site? What about us? Like we're paying for this. Why aren't we advertising for it? So that was point one. Point two, what are our employees doing? Oh, well, they go to the partner site. So they're registering for courses, I guess. What courses? Well, we get that on an invoice, so we'll learn about that in a few months. Okay, that's not great. So how are those invoices? Not great. We get surprise line items. Oh, okay. And then tell me about tuition team. What's your workload? It's pretty tough. We have all this manual work because we don't have the processes and the systems that fit. Did you get additional people? No, we're HR. We're a cost to the organization. Yikes. So does this sound familiar? Yeah, so here, now I started doing some numbers analysis. I like to do a lot of planning and discovery before I actually start developing. So 54% of the courses requested by those 123 employees were charged at an out-of-county rate because our partner was a community college. They have certain formulas for determining per credit rate. That was costing my nonprofit organization that is running on a 2% margin, $122,000 in waste. Yikes, right? And the other thing there, 26% of the course requests, and this one kills me because I'm the L&D professional, I was the teacher in the classroom, resulted in grades of less than a C+, which means according to our policy, we have to start taking this money back from our employees. That's the last thing I ever want to do to one of our employees. That is deflating. That is a poor employee experience. That is not how I want them to see our HR group. And so those were my opportunities, and that's what I was going to solve for. So remember, I was doing that discovery and planning. When I start a project, the first thing I want to do is define what success looks like. Those are the questions I ask myself. Yeah, it's not a Bessie defining success. I'm more of a scientist than a poet, but it works for us. And so what does it look like? What does it feel like? We're a caring organization, so that feeling is always there. We're delivering healthcare, so caring about our employees, caring about our patients, caring about our community. What does it sound like internally in the organization through engagement surveys, through social media posts? And then finally, what is the story we want to tell? There's a survey there from a Guild American Worker Survey from 22. And you can see from there that 47% of the respondents said they don't have the training options. They feel like they're not qualified. Another 39% said, these pathways are unclear. And I heard the term more recently, a lighted career path. I love that term. I'm stealing it, I'm gonna continue to use it. So I'm gonna use that here. So a lighted career path is something that I wanted to create. And that same webinar from Josh Burson, if you look at that top green box around reskilling, he said career pathways are slower to implement. And that's the notion that I disagreed with him. I took it upon myself to say, I can do this quickly. The organization needs me to do this quickly. My employees need me to do this quickly. So I challenged that assertion. And so that's where I began. How many of you are familiar with the Career Capability Academy? That's a Burson term. Okay, so I'll spend a little bit of time on that, the blue box there. Take a look. So it's organized by functional area. My chief nursing officer is my executive sponsor for this project. All of nursing is aligned to it. So I know I have the buy-in that I need. It's led by the SMEs and the business leaders, so check. External content. So these academies are not something, I have an instructional design team. There's way too much content for them to develop internally. I can't rely on internal resources. What I really want to do is create a curated pathway from multiple external vendors, including that third-party college. I need mentors and coaching by design. So I need junctures where my employees can go to for support. And I think this is really, I guess, the last one there, the second to last one, talent mobility. We really want to be able to grow the careers. That's the purpose of this. That's what defines success. So just quick timelines. May 2023, that's when my CNO, Chief Nursing Officer, asked me for the support. July 21st, 2023, executed an agreement with Degreed for their Talent Academies platform. And September 18th is when we launched our Be a Nurse Academy. So that was incredibly quick, incredibly fast, but it required a lot of work. So yeah, that's not my work. One of the things that I was looking for in a partner is the professional services, the experience and the expertise to know what they were doing. And Degreed did have that. So I'm not trying to sell their product. What I'm telling you is my story. And we were able to get this off the ground in 2 months because of work like that. They took my vision, they took our problems, and then they created the solution off of that. And so that was an intense period. We got it launched, it required a lot of alignment between my partners in the tuition team, my School of Nursing, our partners in the local community college, Degreed, and another vendor that we brought in for reading. Everybody was in alignment. I set the vision, but everybody was in lockstep. So it was really nice to have that. And so without that alignment, without that buy-in, without that executive support, this also wouldn't have happened. As part of this program, kind of to distill this, we created 3 custom licenses. What that is custom approvals processes for different programs in the Talent Academies marketplace. So we were able to get that. They have marketplace items. So again, this is another object that you can put into the academy. And so those require approval. So we actually built the courses that our employees needed from that third-party vendor, that community college. So biology is in there, anatomy and physiology is in there. And so when the employee is ready to request that class, they actually select the class. And what this does to us as an organization is now we control everything. We have full visibility. So this is what it looks like from an employee experience. Our Be a Nurse Academy actually created that scaffold. It's marketed on our site now. And while I didn't mention this before, I gave it a name. I was working with my own internal marketing team. They're like, does it really need a name? It's a partnership. I'm like, it needs a name. Please give it a name. And they're like, well, what do you think? I'm like, Be a Nurse. Let's go with it, right? And that's what they went with. They're like, all right. So, and the crazy thing is, more recently, I saw it in a local news article. My CHRO sent me, hey, Anil, take a look at this. And I open it up. I'm like, oh my God, it's in print. Like, people are talking about it. So, the things that you think are like, I got to get a name out there. Somehow it ends up in print. And so it's great, but that putting a name to the Academy is one of the first steps. Marketing it on our own site was really huge. Providing employees with that scaffolded support with the program's advisor and coach, and allowing them to be able to track their progress was really meaningful for them. So they see how many classes they have left, what courses they're working on. It's worked really well for them. From a program management standpoint, equally as well. So remember, we have our tuition team that was struggling with the heavy administrative burden. Now we have electronic agreements. So this is what it looked like in the previous state. From our intranet site, the employee would download a Word document, they'd sign it, they'd scan it, they'd upload it. How many people do that? Not many. Yeah, so we were doing that. We were kind of old school, and I said, do we need to do this? Or can we just have them sign an electronic form in Degreed? And that's what we did. So it made it easier for the employees. We integrated a critical reading skills program. What this did was it allowed the employees to step into the program. We had gated controls. We had partner course selections. We have reporting going to this partner now. That's our PO. So now here's our PO. This is what we're paying for. If it's not on this report, it shouldn't be on our invoice. And we provide them with the coaching and the advisor. So this is what Fuel and Growth looks like initially. So 5 months after we've gone live, if you remember in the entire academic year, so it was running for about 13 months before we relaunched through Degreed. We had 123. In the first 5 months, we had 213 participants. And if you remember that cohort, our School of Nursing has a cohort of 100. So if we continue this, we're going to be able to expand our School of Nursing pipeline significantly. Some other things around talent acquisition. 37% of the participants had been with the organization less than 12 months when they joined this program. 21% of those, less than 4 months. So it's going to be a retention strategy, but it's also talent acquisition strategy. The critical reading skills was one of the most important pieces we put in place. Early data shows that the employees that were participating in this program were reading at a 4th grade reading level. So we now know why they weren't ready for the college level science classes, right? So you're asking, well, there is going to be some attrition here, right? Because now they got to go to the critical reading skills. Is that for every employee? No, we do have an attrition rate of 25%, and that's okay. What it is for the organization is it says who's ready, who's prepared, who's going to put some skin in the game, who's going to put that sweat equity in. That's about $40,000 in savings. If we didn't have the reading program, those people would have signed up for classes and they most likely would have had money clawed back. So I'd rather say, hey, maybe this program's not for you versus clawing money from a paycheck. I do hope to solve for that. We're still early in our use with the Talent Academies platform. So what does that mean? Well, maybe this academy is not for you, but we have all these other academies that don't require a college education. And then around retention. So to go through this entire academy through it takes about 1.5 years, maybe 2 years on the longer side. So they are in their role. They're in this program engaged for 1.5 to 2 years. We actually did analysis on who's participating. The people, 30% or 32% of the people participating in this role actually stay with the organization about 12 months. Now, if they're engaged with this program, maybe they're in that role for 1.5 years, maybe 2 years, because they're gonna do their nursing school and stay in the role. So what that means for us is they are staying in their position longer, which leads to better quality of care for our patients, consistent care. That's really important for us. And then, of course, 2 years to complete their nursing school, and then a 2-year work commitment. So we do tie our academies to work commitments, just depends on the academy, and that will determine the length. So total benefit to our employees, tuition free, is $32,000 to become a nurse. So next steps. We had that original cohort of 123 people. We want to bring them into Degreed's Academy. That's going to be that's probably something that we're going to have in the next 2 to 3 weeks. We also realized through Degreed, we can scale up these partnerships significantly. So remember I said there was $122,000 in waste by getting charged at out-of-county rates. I'm working on extending a partnership to another community college, and that in a year will save us $90,000. And then, of course, other academies to come. So feeder programs, creating medical assistant academy, creating a certified nursing assistant academy. What we want to do is focus on our mission critical roles and have these lighted career paths for them. And then, of course, when we talk about a mature reporting function, to be able to report to our executives on our talent pipelines. So here's where we recruited them, here's where they are in their development process, and here's when we anticipate them going into their new roles. So what does success look like, right? What does it feel like? Well, success looks like when you have employees that are participating in this program and doing well, and they're providing that feedback to your coach and advisor. Like, I didn't know this was possible. Thank you for your help. What does it look like from a data standpoint? When we have employees that video that Michelle showed earlier this morning, that is my passion, right? Being able to unlock the potential in people. And so that's kind of what it looks like from a personal standpoint. That's what it looks like. That's what it feels like. For me, this has been a passion project because it's about equity. I get to develop programs that enable people to not only change their own career trajectory, but the trajectory of their families. And so that's the story of the journey of bringing in the best talent, keeping them there, and helping uplift our people and their communities. Thank you. I think I have a few minutes for any questions.
Right behind you. Testing. Hi. So this might be a little in the weeds, but you mentioned using some Josh Bersin courses in your program.
The Josh Bersin data was taken to help me kind of set a framework, build the foundations of what I wanted to do. You know, that his talk around career capabilities was really, I'd like to build this out. And you know, where I disagreed with him was kind of, he said it was slower. I thought we could do it quicker.
Okay, so more to gather a baseline.
Yes.
Okay. That answers my question. I was going to go into, well, I'm using some of these also in a learning path, and how did you kind of make those in line with your learning program? But if it was more on the assessment side, then, but yeah, thank you. You can probably shout, but I'm going to come over.
Hi, great presentation. Congratulations for the great initiative. I wanted to ask you about the content. You said you partner with a community college. So was most of the content, did you rely on the content mostly only on the community college, or did you also add stuff that you prepared to kind of give it your own St. Luke's personal stamp, you know, values and culture and things like that?
Yeah, that's a good question. So the content from the community college has to be the content because it's a degree program. So they had to provide the biology, you know, that's theirs. We have a programs advisor who now engages the employees. So as soon as they start, he engages them and he tells them what support pieces that they have in place. The culture is kind of integrated into that. But from a content perspective, like the academic content, that's from the partner. And then the reading skills is from a third party, also an online vendor that provides that. And we have a coach that supplements the reading skills as well.
Hi, I'm Renette. I'm from edX. I'm on the learning provider side. I was curious to know where your coaches come from. Is that something you're staffing from inside your organization to partner with learners, or are you drawing on other program advisors and coaches?
I'm sorry, could you repeat that question?
You mentioned that you found that coaches and program advisors were key. Where do they come from? Are they from St. Luke's, or are they from the college? I'm curious about that aspect.
Yeah, thank you for repeating that. So the coaches are part of my team. They're a newer team, and what we realized is technology is only the vehicle. You also need some intentional interventions, and we wanted those programs and coaches to be St. Luke's employees, because it goes to the previous gentleman's question around the culture and really integrating that. We want them to know that this is a benefit of being part of our organization.
Hi, a similar question on the mentors. Did you find in this academy they were coaching more on the content that the learners were consuming, or more on application of the content and
here's how I've used that in my nursing career, sort of what side of the coaching?
Actually, it was neither of that. They're really kind of coaching them on things that are common study skills. So there's now, the coach has a separate study skills program if that's the issue. There's time management, work-life balance. So those are the real things. He does do some reading coaching as well, but that's where people struggle because the employees that are participating in this program haven't been part of, they left K-12 many years ago, or maybe K-12 was not something that they did well in, and now they're learning for a different purpose. And so what we wanted to do is kind of enable them with the basics to help them really be successful in that in those college courses. One of the funniest things, so I got to present to my C-suite in January, and so I was talking about the academies, and they saw that last slide with the, what the future is for all these different academies. And my biggest champion was my COO. So generally he's always like, well, why are you spending this money? And now he's like, well, how can we help you? And so that was something that I found quite astonishing, actually. I'm like, oh, wow, is this really happening? So for those of you all that are interested in this type of venture, what you'll quickly see is that the operational folks will get on board pretty quickly.
This side of the room to see if there's any questions, but anyone over here?
Thank you, everybody. I appreciate your time today.